With America's coronavirus death toll soaring, 3 of the Trump administration's top health officials have testified on Capitol Hill. North America correspondent Catherine Diss has more from Washington.
Hearings went for a number of hours today. Its purpose was to investigate the response by the White House to the coronavirus pandemic, but very quickly it was quite clear that this would just be another excuse to show the deep divisions that this country is currently experiencing and just how deeply divided that the response has become to the pandemic. Now, we heard from Dr. Anthony Fauci, Robert Redfield, the head of the CDC, and Brett Garreau, who is the man in charge of the testing regime. Anthony Fauci kicked off the evidence. They covered a great deal of ground, but the points that sort of stood out to me was his response to why the US is in a much worse position than what the European Union is. He said that was for a number of reasons. One, that America really only shut down 50% of the country from a functionality point of view, whereas European cities were far more strict in their lockdown measures. Other reasons, he noted, was that there was no national mask wearing strategy, and people also failed to properly socially or physically distance and avoid large crowds. And of course, wearing a mask here has become a highly political issue, with the White House refusing to put in place any sort of national standard and leaving it down to the states to make those decisions and impose those restrictions on their citizens. In terms of the CDC Director, Robert Redfield, he revealed that he wasn't consulted or told about a change by the Trump administration for how hospital data regarding coronavirus patients was to be collected and reported. Traditionally, or for the vast majority of the pandemic, that has been handled by the CDC, but the Trump administration has chosen to change that, whereby federal contractors and the states are now in charge of that process. And just in regards to Brett Garreau and the testing regime, he admitted at this point in time that it was not possible to get the turnaround on those tests down to 2 or 3 days. In some parts of the country, it is now up to 7 days, if not more. And of course, that defeats the purpose of using testing as a way of stopping spread. But just to give you an idea of the partisan sort of politics we saw on display today, let's take a listen to an exchange between Dr. Anthony Fauci and Republican Congressman Jim Jordan.
Should we limit the protesting?
I'm not sure what you mean. How do we say limit the protesting?
Should government limit the protesting?
I don't think that's relevant to...
Well, you just said if it increases the spread of the virus. I'm just asking, should we limit it?
Well, I'm not in a position to determine what the government can do in a forceful way.
Well, you make all kinds of recommendations. You make comments on dating, on baseball, on everything you can imagine. I'm just asking you, just said that protests increase the spread. I'm just asking you, should we try to limit the protests?
No, I think I would leave that to people who have more of a position to do that.
The major hotspots that had sort of sprung up in a second surge of the virus were southern states. California, Texas, Arizona and Florida were really being hardest hit. But cases in those states have now started to stabilise, albeit at very high levels. Like, we're talking 8,000, 9,000 cases a day, but they're coming back from the peaks that we saw above the 10,000 mark just a couple of weeks ago. The virus is now spreading into a number of other states in a fairly big way. There are outbreaks in 27 states where cases are continuing to rise. Some of the worst ones are Mississippi, Tennessee, Oklahoma and Missouri. And we're now seeing the death rate catch up to those cases, which of course there is a lag time between when someone gets infected and when someone gets really unwell and then unfortunately passes away. So we're now seeing that death rate sort of consistently above 1,000 cases a day, where I think yesterday we recorded just over 1,200 deaths from the virus.